What's up, everybody? Welcome to Puzzle Huddle with Experts. I'm very fortunate to have Dr. Monique Shaw. She's a PhD health policy expert. She's a wife, she's a mom, she's an advocate for diverse communities, and I'm really excited to have her. How are you today, Dr. Shaw?
I'm doing well. How are you?
I'm great. As my point of entry, just to set up the conversation, so we know what space we're having our discussion. What are the things that you have your professional expertise in? What are the spaces where your acumen is really high and you know a lot about specific things?
Yeah, so my background is in public health and maternal and child health policy. I'm also a trained full spectrum doula. And so those are the areas where, in terms of health policy, health equity, those are my areas of expertise.
Wow, this is very nuanced stuff. But before we get into, well, I can't move forward without asking. What are some of the things that you do as a doula?
Yeah, so doulas are essentially care support folks. And so they are people that really provide care and support, not clinical care, but human care
Mhm.
and support to birthing people and their families. So you have different types of doulas. As a full spectrum doula, I support birthing people across the full spectrum of reproductive health. It could be anything from assisting a mom during labor and delivery. It could be postpartum care, so helping to
Yeah. Oh,
wash
yeah.
dishes, do laundry, help with other children that families might
Wow.
have,
Yeah. Yeah.
and really just being there to support the family during a very important, but also sometimes can be very stressful, period of time where there's so much change occurring. So it's not a clinical, profession, but does not mean that isn't just as important, to support people in their emotional health and well-being, during really important times in their lives.
All right, I'm stuck. I'm going to get to my other questions, but with the first time you have a baby, I know the experience as a dad, but I'm just extrapolating for the moms. It's all new things. Like your first time having a baby is your first time, so you don't know all of. So unless you've had some sisters or friends or some experiences where you've been really close to everything that happens, wow, is a lot of new things that are taking place that you take your classes, read your books, watch your videos. You haven't lived through it, so it's just going to overwhelm you. There's no way to get ready for this tidal wave of stuff.
That's right. I mean, but even as a parent, like having an adding an additional child to the family can also
Yeah.
bring along a lot of uncertainties and challenges that you didn't experience even with a first child. And so and oftentimes, when the birthing person is pregnant and walking around, everyone's like, oh,
Yeah.
so focused on you. And as soon as that baby is delivered, then it's no longer about mom. And so
Right.
my job is to really be there for mom and for dad and for family,
Because
as they're
people come in your house and they're no longer interested in talking to you.
oh
They
yeah,
they want to see
where's
this
the
child.
baby?
Right. So never mind. Are you thirsty, hungry? Does your back hurt? Did you eat anything today? What did you get a nap? Where is this baby? It's
Right.
put this baby in front of us so we can goo goo and gaga. Which is great, but wow, it is not the most helpful thing to the mother sometimes.
That's right. Or the dad. Yeah, that's right.
Yeah. So what are some of the things that you most frequently provide as support? Like out of all the things that you can do, like what ends up being like the thing that most of the moms and families end up needing from you?
So in my experience, moms have really struggled with breastfeeding, and I'm
Yeah.
not a lactation consultant.
Gosh, yeah.
And so sometimes you do need a referral to, a lactation consultant, but other times it is just about creating the right space and environment for you to be able to learn together with your baby. And if you
Yeah.
can remove some of the other stressors and some of the other things going on to allow for that, time for connection and learning together, it's helpful to mom. A lot of times sleep, you know,
Yeah.
need- needing to take a shower,
Hello.
take a nap,
Big time. Big time.
straightening up, around the house
Yeah.
in terms of postpartum care. And during labor and delivery, I really see myself as being an advocate for the family and their wishes, and really making sure that they're being listened to and that they're receiving, respectful care. And a lot of times, during, a period where you're, experiencing so many different emotions, you might be having, experiencing some pain and discomfort. It's
Yeah.
also hard to advocate for yourself in those circumstances. And so I'm really there to understand what the birth plan the parents have, what is important to them, and then making sure that that is followed through and carried through, and providing comfort in any ways, that I can. It's very individualized, in terms of what folks want and what they need. And it's, building that relationship
Yeah. Yeah.
up until that point that's really um integral, because you want to be able to for people to be relaxed and feel that they're going to be
Right.
safe and taken care of. Yeah.
Yeah, in terms of finding a doula, if people are interested, are you able to be a doula? Are you specifically, can you connect with a new family where you don't have any previous context, or does it really work best if you're familiar with the family and you're just stepping in?
No, I mean, it really depends on the person. I have supported folks that I, did not have a prior relationship with. I've also supported, one of my line sisters, a family friend.
Yeah.
So it really just depends on what you're looking for, and also, whether or not a person is available, how close they are to where you live, the relationships that they might have with different hospital systems and where you
Right.
might be planning on delivering. So lots of factors go into it. So I definitely say, like, do that folks should do what's most comfortable for them, and to do their research, and not just select someone, just because, but invite a couple of different folks to,
Yeah.
to talk to, and see, what's going to be the best fit for you and your family.
All right. Now, one more question on this, and now I'm gonna try to get out of your personal business.
No, no.
But you have a full-time job, you
I,
have 2 children, and you have a husband. How are there any more minutes available for you to be into this other career space and be, very supportive for a family? Like, how do you find time to do this in addition to all the other things?
yeah. So, I have to say that I have the flexibility to take on clients as I, sort of have the space to be able to do. There are folks that are full-time community-based doulas.
Yeah.
And I want to make that distinction because, those folks are doing incredibly critical and important work, particularly in communities of color that are experiencing significant harm, and, with our maternal health care system.
Yeah. Oh yeah.
And they're underpaid, they're under-resourced, they oftentimes are not reimbursed by insurance or Medicaid for, our birthing people that, have lower incomes. And so I do want to, sort of give, some, credit and respect, right, for those individuals that are doing that work. Because I also have another full-time job, I'm able to get calls and requests and talk to families, see sort of like when their due dates, are
Yeah.
and sort of build it in and plan out in that way. And I have a lot of flexibility in my full-time role to take time off,
Yeah.
when I need to in order to do it. So yeah, I'm very fortunate in that way.
All right. Now you said we're going to get to your childhood in a minute, but you said maternal health, and you,
Yes,
you have a PhD in health policy.
I
So
do.
so what are some things that are that you've observed related to maternal health, diversity, and it kind of pulling from your research and your professional experience? What's going on with the diverse community and the impact or the results we're seeing in terms of maternal health?
Yeah, they're pretty abysmal, unfortunately. And, maternal and infant health, indicators of maternal and infant health um, are the top uh, indicators that are used to really understand how well a country is doing,
Yeah, yeah,
right, overall. And out of all developed nations, we have one of the worst maternal and infant health outcomes in the world, right? And so we have a significant amount of money and
yeah.
resources,
Uh-huh.
a very advanced healthcare system, but yet Black women are dying at rates 3 to 4 times higher than their white counterparts. And it doesn't matter the level of education of a Black woman, where a Black woman lives,
Yeah.
sort of those typical things that we use to really understand disparities in health outcomes. When it comes to maternal health, maternal mortality, Black women die at rates 3 to 4 times higher than their white counterparts. And it is really due to systemic and structural racism is the underlying cause of that. And so Black women not being listened to when they are reporting, issues or challenges that they're experiencing with their bodies, respectful and culturally appropriate care not being provided, women not having access to care.
Mhm.
Lots of things that go into the disparities, and these disparities have been really long lasting. Like, so for a very long time, our country has been dealing with these, extremely poor outcomes. And not enough has been done, right? And now it's becoming more popular to talk about.
Yeah.
We're hearing it more in the news. We're hearing it more in the media. We're seeing policies that are being developed by a lot of grassroots organizations on the ground, like in their localities, but then also federal policy like the Black Maternal Momnibus Act, that are all sort of in response to these outcomes that we're continuing to see for Black and Indigenous also moms that are delivering in this country.
Well, what can diverse moms do? It would be hard to know that you're going to have a bad health experience before it happens. So how do you help get ahead of the curve so that you have the best chance of having a healthy experience being pregnant and birthing the baby? What's the checklist, or what can moms do to help kind of sure up the process so they're going to have as good of a experience as possible?
Yeah, that's such a good question. And I think, a lot of it is really doing all that you can to create a support system and network to really help you and your family along. So women will, hire doulas or get doula support so that they can, really learn about what some of the risk factors are, what some of the challenges might be, and have an advocate, sort of along the journey to help the family. Midwifery care, there are a lot of, there has been an erasure of midwifery practices when as a part of the industrial medicalized complex, just really erasing an entire practice of care that had really, really important cultural, right, roots, and different practices that were embedded into midwifery care, and sort of excluding an entire profession
Yeah.
of care has really caused a lot of problems as well. And so, folks are really learning about what their options are, right? And in terms of being able to birth in a hospital setting, but if you don't have a high risk birth, being able to perhaps do so in a birth center, where you have people that look like you, whether or not, whatever setting you're in, right? Making sure that you're able to find a support system, both clinically and also practically and emotionally, for the process that you and your family are going to be sort of going through. And so I think those are a couple of things that folks do to make themselves just feel more knowledgeable about what to expect, and also to feel that they have advocates, and to really continue to speak up, right? If you see something, say something. If you feel that something's not right, say something, and really call on your support system to also activate to really help you if you feel that you're in need.
Yeah, it's interesting that you mentioned that it isn't based on education level, because you would expect, with a higher levels of education, that the outcomes would improve, um, just based on information and network and access to solutions and, health benefits and all the different things that you might establish with a higher education. But
Mhm.
gosh, if it crosses all educational levels, like, that's really problematic. And I think about how the media positions, low income pregnancy is, unplanned, and
Mhm.
when you have, high education, it's planned, but just how the system might absorb those two populations differently.
Oh, absolutely. Absolutely. And, and that gets really into sort of the narratives that our society promotes
Correct.
about people of color in general,
Yeah.
and that are extremely harmful, and the biases that folks that have these really important jobs and roles really carry with them on a day to day. And so it really gets into some of the like interpersonal biases
Yeah.
that really need to be addressed. But then there also are structural and systemic issues within the healthcare system that perpetuate a lot of harm and the poor outcomes that we see in birth. So there's a lot more work to be done in this area, but there are a lot of really phenomenal leaders in all different areas of policy, research, grassroots organizing that are, culture, narrative folks that are working on narrative change and culture shift work, and artists. And it's important for us all, right, to really take whatever passions and expertise that we have to really see, what it is we can individually do to collectively work to solve this very important problem.
Yeah, I saw recently there was an artist that reconceptualized a lot of the maternity posters and literature and the artwork that you see in doctor's office, explaining, the stages of pregnancy.
Yes.
You're right, and just
And
picturing
use
it.
people of color, right? Like,
Right.
yes, I did see that too.
It's
Mhm.
going to change just in a very nuanced way the way those patients experience health, because it may trigger the doctor's thinking.
Yeah, I mean, and still, like, there are textbooks that our clinicians are being trained on in schools that say in them that Black people or people of color don't experience pain in the same way as other people. I mean, just ridiculous, things that people are still reading and being trained on as professionals in our country. And so, like I said, there is a place and a space for everyone to be
Yeah.
working on this issue, because it is bigger than just maternal health. And I just encourage everyone to really find how they can contribute.
All right. And now to your child, for you to have a PhD in this topic space or health policy, this is very is very specific things. Are there any, was there a suggestion of this in your childhood? What about your childhood may have set you on a course to pursue this professionally?
Mhm. Yeah, that's a great question. There were a couple of things. So I grew up on the west side of Detroit, on a street called Lawrence between Dexter and Linwood. Um, and and I was shipped out. I say shipped, but I was driven far distances to school. And it was really that dichotomy between sort of seeing what I was seeing in the neighborhood where I was growing up in terms of how well people were doing, how healthy they were. Um, it was a clear distinction between, even in my own family, what people were experiencing, and then what I was seeing when I would go to school.
Yeah.
And the experiences of the friends of mine who lived out closer to, where I was attending school. And so that really, was interesting to me. Like, why is it that, in my community, I'm seeing homelessness, I'm seeing, drug use and addiction, I'm seeing poverty, I'm seeing, heart attacks or just sudden deaths or early deaths. People that are really young in their 40s and 50s, and I wasn't hearing, and I was, my friends that lived in other places experiencing, those same things. And so it really got me interested in health. And furthermore, in health disparities, and really trying to understand why the experiences of some in our country are different than others, and then how that plays out as it relates to health and health outcomes. And so that sort of sent me on, I'm a first generation college graduate, so I always had a love for science. Yes, yes. First gen college graduate, a love for science and health. And so my parents always says, well, you should be a nurse or a doctor. That's, what they knew. I grew up reading Gifted Hands and, learning about Ben Carson. Alexa Kennedy is one of my, sort of favorite role models. And I grew up reading about her. So I'm like, I'm going to be a doctor. I'm going to be a doctor. And then I got to college and started off on a pre-med track. I actually went to the summer of my senior year of high school. I said, I'm going to go to college early. And so I went the summer before college and studied, pre-med and enrolled, in a pre-med.
You had grades in high school. This
Pre-med track.
you wasn't this not no 2.5 type of stuff.
No, I had good grades. I had great grades in high school, and I was really committed and passionate. And then, I started taking, the biologies and the chemistries and all the courses, and got to Orgo.
Every bad student, boy, that organic chemistry, that's gonna be some of us gonna be over here when this is over. Some of us gonna be over here.
Yes. And wow. I was on the opposite side. Okay. I'm like, this is not making sense. It's a foreign language. I don't know what's happening. And I ended up, so I stuck with the pre-med track, but I did switch my major to psychology. But then I started getting into like sociology and anthropology, which was really, really interesting to me. And so I decided to go to public health school. In which, was a mentor of mine, really suggested, like, why don't you apply to some like dual degree MD and PH programs? And that brought me here to Philly for my master's of public health. And once I started my program, I said, like, this is what I, love. This is what I want to do. And it really, to me, so much of my career trajectory and what I continue to do is I love helping first generation college graduates really explore all of the various things you can do in like the health sciences profession, because a lot of first gen students that are interested in health and sciences and STEM, they're really sent on a medical school or nursing school kind of track. and really advised to sort of start off that path, not really knowing, what the other opportunities are for them. And so I do like to, spend some time also helping and counseling, and providing support to other first-gen students that.
Before before we get into your graduate school education, I want to spend a little more time in this undergraduate education.
Okay, yes.
How did you decide on the university that you decided? What were the factors that were relevant as you were choosing a university?
So I knew I wanted to go to an HBCU, and I had a cousin, her name is Lauren. She's actually a professor at Howard now.
Oh, wow.
Yes,
Look at her.
in the physical therapy program. And she was at Howard when I was younger. And, as I was, talking about going to college and exploring, HBCUs, she said, well, you should come and visit me for a long weekend and I can take you to, to campus and to some of my classes.
Oh,
And
that's all it takes.
that's all it took.
You're done. I was
hooked.
thinking about this the other day. If you step on that campus in the springtime on a Friday,
Listen.
you're done. What else could you want?
Yeah, I think at the time I was in middle school. And I was like, oh, I'm coming here. I'm coming. She took me to class. She also worked on the athletes because she was in the PT program.
Oh, wow.
And then
Yeah,
she took me to bar, and she was rapping and like providing treatment to some of the like football players. And she took me to class. Then we went to the punch out. I don't even know if it was a punch out back then, but she took me somewhere on campus that had some good food. And I was like, and all the Black folks walking around and just Black excellence everywhere. And I was like, listen, can you sign? I said, sign me up today.
This is that. I don't need to look for nothing else.
Nothing
this
else.
Is the right place.
So it was my number one choice.
All right. And then tell me about your undergraduate experience, because I know that you found lots of things to connect with and participating in campus life. What are some of your favorite things that you did while you were at Howard?
Yeah, so I was on student government. I was, while at Howard, I was a recording secretary for 2 administrations. And being on Power Hall was such a great experience for me. 2 of the things that also really stick out in my head during my time at Howard was one, my freshman year, unfortunately, was during September 11th. And I remember,
and in DC too, because there was another plane.
DC.
Yeah, that second plane crash. Wow.
That's correct. And I remember we were one of the largest freshman classes that Howard had ever seen at the time. And so there were a lot of housing issues. And
yeah, I remember.
Yeah. And so there were a significant number of students, I believe they were sophomores, that were guaranteed housing, but that were pushed out because we had such a large incoming class. And they were actually staying at hotels across the street from the Pentagon. Like that's where the university was housing them. And I just remember being in English class and someone came in and spoke to my professor. And then she just immediately sort of told everyone what was going on. And, students started crying. Folks had family members, that worked at the World Trade Center and at the Pentagon. We lost, I think a professor at Howard lost his wife in that attack. And so that it was just a really, it was such a difficult and challenging time, but one that, looking back on it, I don't think any of us knew the implications that day would have on our lives for decades to come, right?
Forever.
Right. We didn't really, as an 18-year-old, I didn't really understand like the significance of that period of time. But it's one that also, I remember just, we were so resilient, right? And we really, stood together and stuck together as a student body during that difficult time. Hurricane Katrina was another example where we invited, that happened too while I was in, there was a lot of like disasters.
Because we absorbed some students, the university absorbed some students.
That's right.
Yeah, wow.
That's right. But just seeing how like when we come upon challenging times as a people, like how we really come together to support one another. and to support our communities. Like that is something, like those times I will never forget. And they're really really instilled in my values and how truth and service, right? And how I operate and what I teach my kids. So those are a couple of moments that really, looking back, make me proud to be a Bison.
Yeah, one of the things I think is really profound about the experience at any HBCU, but if you're of a personality and a disposition to get involved in student government, like the return on that cluster of people, these people are not done being high achievers.
No.
If you blink and 10 years later, this group of people, they're running everything.
Oh yeah, somebody's gonna be president, I'm sure.
Oh, you turn around and it's like so-and-so is a director, so-and-so
Yes.
owns a they really transition out of university and go fast to high levels of achievement.
Yeah, I mean, and it's so interesting because you think about like the characteristics and the drive and determination that it really takes to come to a new place, right? Experiencing college for the first time and really want to like run stuff
Yeah,
and,
yeah.
and really want to be a voice, right, for the student body. That special people, right, really are attracted to those types of roles and positions in college and also in life. And so I'm really lucky to have had the opportunity to work alongside some really great and accomplished people.
Yeah. Now step me into your master's degree, because I read something in your bio about a project called Bridging the Gap, where
Yes.
you captured. Can you describe what the foundation of that project was and what the results were?
Yeah, so I worked for an organization called Philadelphia Coordinated Healthcare, and we were one of 7 healthcare quality units in the southeastern region of Pennsylvania. And we supported adults with intellectual and developmental disabilities. And we would go around and provide, we had a staff of nurses, that would provide training, like healthcare training, to some of the homes where these individuals were living. I was the over the community outreach program at the organization, and so we would go out into the community and try to make sure that families that were in organizations supporting the adults with intellectual and developmental disabilities had the appropriate resources, were
Yeah.
connected to insurance, and really were connected to work, had places to go to work, and that their health was managed. And this organization was responsible for after the Pennhurst, there was a lawsuit that actually closed several large institutions where these folks were traditionally housed historically in Pennsylvania, and they were responsible for integrating them into the community.
So people with mental health conditions, to the degree that they need housing, they're not able to, live at home or live with
Alone, correct. And previously, and many of them have, there are folks with just, intellectual disabilities, but then there are also folks that have co-occurring, mental health challenges.
Yeah.
And they were housed in institutions where the conditions were deplorable, and their health, was not being managed appropriately, and they were like imprisoned and not able to live, normal and healthy lives like, the rest of us, right? And so those institutions were closed, but then it was like, what do we do with all of these people? And so they were responsible for integrating those individuals into the community and making sure that they had the appropriate services and supports. And so I did a Bridging the Gap project where I'm not sure if you're familiar with StoryCorps, but I worked really closely with StoryCorps, and they came to our facility and they interviewed individuals with intellectual and developmental disabilities and someone that they cared deeply about, or a support person, or someone that they loved. And so the interview was those 2 folks like really talking to one another, right? And so there were a lot of things that you learned There's such stigma attached, to individuals with IDD or with mental health challenges. And, the purpose of this project was to heighten people's awareness and knowledge about what it's like to have a developmental disability or a mental health challenge, and to hear their stories from their perspectives in conversation with someone that they loved and cared about. It was a phenomenal project to get to work on, and all of these stories are housed in the National Library of Congress, and will be kept there. And so
Yeah, it's great to humanize those experiences, right? Because you see somebody with a mental health disability, and it's really easy to treat them at a distance and not understand like what happened, what is the diagnosis, and how did they get here, and then their human story. It's not, they didn't just land as an adult with mental health issues. They had a lot of years of development before they got to this place.
Yeah, and there's so much that we can learn from folks
Yeah.
that have to deal with so many challenges on an ongoing basis, when when society is not really designed or set up for you to thrive, and yet here you are doing it, and how you've been able to do that, and what type of support you've had along the way. And like you said, to humanize, right? People that are different, that are differently abled, and that have different challenges is something that is really important for me, and could be used. And those stories could be used to increase awareness. They could, really influence, policy decisions that are made. And so it was really just a great project to have a platform where folks felt like their voices and their stories could be heard.
That sounds really, every time I have experiences with mental health, I learn so much about how to treat people in those nuanced experiences. All right, now take me to your PhD. We went through your childhood, your undergrad experiences, your master's degree, and now what did you study for your doctoral degree and for your dissertation research?
Yes, so my PhD is in health policy. And for my dissertation research, I did a case study on Michigan's perinatal regionalized system. And so it was
those are big words now.
it was a maternal and child health related dissertation, but essentially, Michigan at one point in time had a regionalized system of care where infants that were born preterm or of low birth weight were transferred. If they were born in settings that were not able to care for them, there were plans in place to transfer them to risk appropriate care. So that's essentially, is what perinatal regionalization is. And then they went through a period of deregionalization where there was a lot of NICUs were popping up all over the place. There was like a proliferation of NICUs because care is the most profitable, right, for hospitals. And so you had all of these NICUs, but that, had different and varying levels of care, for babies, and also various levels of care for moms. And so there was a period of deregionalization. And so I wanted to study, right, that period of deregionalization, and then the current efforts that are underway to regionalize the care in the state of Michigan.
So when you're saying regional, you're not talking regional like Southwest, Northwest, Northeast, East Coast, West Coast. You're talking regionalization like hospital to hospital within the same city?
Hospital to hospital within the same state.
Within the same state, okay.
Right.
This isn't like transfer the care down south and you're up north.
No. This is all within the state of Michigan.
Okay.
And a lot of people don't know that hospitals have, even NICUs have different levels of care. And so I think the common person just thinks like a NICU is a NICU is a NICU. Yeah. Like you're getting top level care. You have top.
Right. This is like the premium support here because
it's a NICU.
Right.
And that's not the case. There are graduated levels of care. And so it's important to make sure that, infants that are in need of a certain level of care are able to be transported to receive that care. And But because there is so much competition among hospitals, because they're
Yeah.
profit generating
Yeah.
institutions, some of those sort of MOUs and agreements of transfer have, been, have gone away, and that really has an impact on people's care, and really, where you live, right, and what you have access to in your backyard in terms of what levels of care the hospitals in your neighborhood, are able to provide can be life or death in certain circumstances, especially when you get out to rural areas of Michigan where a hospital is,
Yeah.
sometimes an hour plus away, which presents a lot of challenges for high risk pregnancies and births. So that's what I did a case study, and I interviewed a lot of different stakeholders to really understand the implications of deregionalization, and then what the efforts were that were underway to support regionalization again in the state after over like a 10 to 15 year span of time.
So you described it, but what do you advocate for with that insight? After you take all that you learned, what is the change that you would like to see or implemented in the system to support that aligns with your research findings?
Yeah, so I mean, regionalized care is really critical, and it's important. It improves outcomes, making sure, but not just making sure that babies are transported to risk appropriate settings, but that moms deliver in risk appropriate care settings. And so that mom and baby, right, are able to have an experience and have the resources to the care that they need. But what that will take, it will take a lot of stakeholders that have varying priorities to work together to make that happen. And so the policymakers, have perhaps competing priorities. Healthcare administrators might have competing priorities. Providers, also payers, right? So the challenges with if a mom, delivers in one setting and then that baby is then transported, the hospital where the mom delivers does not get reimbursed for the care of that infant. It's the hospital that receives the child, which causes like some of those policies, right? Really perpetuate and deepen the competition amongst systems. And so there are a lot of changes that need to happen. This is a very small slice of a much bigger pie of all of the varying challenges that we're facing to being able to deliver respectful and quality and equitable maternal and child health care in this country. But it's important for tables to be created where those different stakeholders can really work together and really start to move a lot of those silos, right, that are oftentimes created between professions and systems, to remove those barriers and begin working together to create a better solution for our families.
Yeah, because if you live regionally in a location with a lower performing hospital, or hospital that has outcomes that aren't as good as a better hospital, can you only receive care from the most local hospital, or your ability to connect with the network of hospitals to get the best outcome?
It depends on a lot of things. It depends on whether or not you have insurance. It depends on whether or not you have transportation,
Yeah.
time. If you're a caregiver for a parent and you have 3 kids and you're expecting another, can you really take time, and you don't have paid leave for work?
Oh, yeah.
There are so many,
It's a really challenging thing.
so many policies, that really compound and create situations where people cannot and feel that they can't access the appropriate care for themselves, and that's a real problem. And we live in a country that finger points at people for that, but it's really our responsibility to shift and reform the systems that create these circumstances and environments where people have so many barriers to accessing care. It's our responsibility to remove those barriers. It's not an individual responsibility. It's a collective one.
All right. One more question, Dr. Shaw, and I'm gonna let you go.
Okay.
What is your favorite thing to do at work?
Oh, my favorite thing to do at work. So I'm in philanthropy, and we do a lot of talking. I'm a people person. And so I think, one of my favorite, and I'm working from home now, so it's a little bit different than when I was in the office. But I really love just having check-ins with my colleagues and really learning more about them as people. I'm a people person, and I really do believe that when you show up and when you're able to show up in your profession, no matter what it is, as your full authentic self, it just brings so much more light and warmth and joy into spaces that, where you're really grappling with and trying to solve really difficult and challenging things. So I love just getting to know people, and my colleagues just, a lot better, more personally.
Yeah, I think it's obvious from your educational path, your professional path, and even your childhood. You're going to get to the people. You're not going to stay behind a wall
No.
for much time at all. You might deal with the wall out of circumstance for a moment, but to get fulfilled, you're going to have to get out and connect with populations of people. So I'm glad you're able to find ways to do that. Now, I can't help but this one. With all this expertise, how does that inform how you parent? Do you show up specifically as it has to inform your parenting strategy and techniques in lots of ways, but what's an example of how all this information shows up in you as a parent?
When I think that I'm taking all of this, expertise and, and I have a plan for my kids and how I'm going to parent. And what I realize is that my kids teach me so much. Yeah. Like they themselves coming into the world and being given the respect and the space as a young person to have an opinion for yourself, to have goals for yourself, values for yourself, and not have them be imposed on you. That creates a whole different child, right? And so I have some of the times where I felt like I'm, instilling and, doing all these things. And my kids are like, well, actually, I think this is what I think. And I think this is, and I'm like, oh, you there,
And you try to honor that in them. You try your best.
Right. You really try to, and just keep them safe and let them grow. Really, like I said, into their authentic selves. There are so many experiences that we have, that we've had as parents, and quite honestly, some trauma, right, that we carry as adults. And I've just found that when I, try to do too much, it's that trauma and those past experiences that I had that they may or may not have, that really creep into my decision making. And it's when I really talk through with them, let them grow into their own selves and have more of a say over, what type of people they want to be, what they want to do, how they might approach something. And of course, within boundaries, right? I'm not just letting them go all over the place. It creates a really interesting opportunity for us both to grow together, like my kids and me and my husband, as a family. So I guess that's one thing that I've learned in this whole parenting journey that is a lifelong one. So who knows what will happen years on from now.
All right, Dr. Shaw, this has been absolutely wonderful. So thank you so much. For the audience, please like this video, subscribe to the channel so you can see our upcoming videos. Dr. Shaw, I really appreciate your time this morning.
Yeah, thank you so much, Matthew. So great being with you. Take care.